Eric, Sandy, Carson, Jasper, and I are going to be presenting about titanium dental implants. What are dental implants? They are artificial tooth roots made up of different materials, usually metals, that are placed into your jaw in order to replace the tooth. Tooth loss happens to be very common and can happen as a result of injury, trauma, tooth decay, and disease such as periodontal disease. Based on the statistics shown on the slide, you can see that there is a great use for dental implants, whether it be to improve oral health, appearance, or speech. They can also be used to replace a single tooth or multiple, and it can also be used to replace all of your teeth using bridges and dentures. So now I'll talk about the different types of dental implants based on their placement. There are three types. Endosteal is the most common, and they are shaped like small screws and placed into the bone. The second is subperiosteal, and this is used when there isn't sufficient bone. And basically there is a scaffolding that is placed around the bone. The third is transosteal, and this is used when there is not sufficient bone for the other two options. And the implant is actually placed through the bone and screwed into a metal plate on the other side. And this option requires an additional surgery.
The use of titanium dental implants has spanned 6 decades, and the first documented titanium dental implant dates back to 1965 when Dr. Brainmark, an orthopedic surgeon, first used a 2-stage threaded titanium root form implant in his patients with deformities of the chin and jaw. Since then, several companies have designed and manufactured titanium dental implants, one of them being Straumann. Straumann first produced a hollow titanium cylinder implant in 1974 and have produced different titanium implant systems since then, with their most recent TLX dental implant system becoming available in 2021. Thus, titanium dental implants have existed for quite some time, but several new models like the Straumann bone-level tapered implant, the Straumann BLX system, and Straumann TLX system have all been released within the past 10 years.
So what are the important properties of an implant biomaterial? There are three categories that are important to look at, and those are bulk, surface, and biocompatibility. So for bulk properties, elasticity is important because an implant material should have a modulus of elasticity of 18 GPa compared to the bone. This is to ensure that the distribution of stress is uniform throughout the whole implant and to decrease the movement around the bone. When looking at tensile, compressive, and shear strength, you want them to be high to prevent fractures and lower the stresses on the implant. When looking at yield and fatigue, they need to be high. They also need to be high to prevent brittle fracture under cyclic loading. For ductility, according to the ADA, a minimum of 8% is required for dental implants. This is important for contouring and shaping of the implant to fit in the jaw. When you look at hardness and toughness, an increase in both of these helps reduce wear of the implant material and prevents fractures. Now for surface properties, surface tension determines the wettability of an implant. This is important because it shows better osteoblast adhesion on the implant surface. When you look at the surface roughness, any alteration influences the response of cells and tissues by increasing surface area of the implant next to the bone, which increases cell attachment to the bone. Biocompatibility is important because you need to know if there will be a favorable environmental response to the placement of the implant. This is dependent on corrosion, resistance, and cytotoxicity of corrosion products. You want to make sure that the loss of metallic ions does not cause the implant to fail.
The Straumann titanium implants feature two very important features. One is the SLA active surface, and the second one is the rock solid material. The SLA active stands for sandblasting, large gray, and acid etch, and that pretty much gives the implant micropores and roughness for better cell-to-cell attachment during insertion. It was reported to have 98.2% survival rate after 10 years of inserting the implant. It also reduces the healing time of the implant from 6 to 8 weeks to 3 to 4 weeks. The rock solid is the alloy from which the implant is made. So instead of only titanium, it has 15% zirconium and 85% titanium. That alloy allows for higher mechanical strength rather than just titanium. Rock solid also gives the implant great osseointegration capabilities, which therefore allows for a less invasive procedure while the dentist is inserting it. The new BLX system is a new system that allows for reduced chair time, increased efficiency, and immediate delivery. It has the same features that we discussed before, the SLA Active and the Rock Solid, but it also adds a couple more features. It has a reduced neck diameter, therefore it adds less stress on the bone. And it's also designed with cutting elements that allow for bidirectional insertion. So that means when the dentist is inserting it, it allows for the implant to rotate both directions, and that adds more flexibility to the procedure.
What are the important factors to know about and to follow when using this material? So long-term dental implant survival rate, it's a very important one. It said that the long-term survival rate for a period of 12.2 to 23.5 years, it was to be 88.02% for Straumann dental implants, and a portion of 82.8% of patients with implant losses who had a medical history of periodontitis. Another important factor to follow is the clinical and aesthetic outcome, and of course patient satisfaction. So we have that the patient bone level was between 0.10 and 0.27 millimeters, and the probing pocket depth was 2.57 millimeters, which basically stated that there was no difference between augmented and non-augmented sites. For the ICI test, which is a test done for aesthetic purposes, the results were 67 and 75% of the cases, which was pretty high, which is a pretty high number for the ICI test on aesthetic. And the satisfaction was between on the high 8.9, and that's for the BAA score, which was also a pretty high satisfaction rate. And the other important factor that we need to follow is the stability in bone with different diameters. For this case, we look for TE designs versus BLX, and the study showed that the TE designs with a wide diameter in simultaneous implant placement with sinus lift could present a higher implant stability quotient and a bit more appropriate option for implant recipient sites with poor bone volume and quality.
One of the newer players on the block to compete with titanium-based implants are zirconia implants. Noble Biocare developed an entirely ceramic dental implant named Noble Pearl in 2018. This implant is made of zirconium dioxide, more commonly known as zirconia, which is metal-free. One of the benefits of choosing a product like Noble Pearl is the fact that zirconia statistically demonstrates less bacterial adhesion than implants made primarily of titanium, meaning they have less plaque buildup. Also, because it's metal-free, patients with zirconia implants will not experience the galvanic effect that can sometimes be experienced with titanium-based implants. Now, studies have also demonstrated that zirconia implants have greater implant-to-bone contact indexes than titanium implants, while also maintaining comparable osseointegration to titanium-based ones. And additionally, as can be seen in the picture to the right, zirconia implants like Noble Pearl are whiter in color and demonstrate less mucosal discoloration than titanium, so they make a great option when aesthetics are being considered. However, zirconia implants do have their own set of drawbacks. Zirconia has high compressive strength, but it's more brittle and therefore more prone to fracture under forces that cause bending or flexing. And it's also just a newer material. There's a lot less data to support its long-term success in patients compared to the tried and true titanium implant. And because it's new, there are a lot less options with abutments with zirconia-based implants. And when considering any implant, surface technology to manipulate roughness, porosity, surface chemistry play a huge role in the success of the implant in patients. And as of 2019, there is no method to demonstrate a statistically significant way to change zirconia implant surface technology for increased integration. And the last thing, if it comes down to $1, zirconia-based implants are just more expensive than titanium-based ones.
As a group, we do recommend the use of titanium dental implants in clinical situations where placing an implant is the recommended treatment option. The information provided in this presentation and published literature supports the use of titanium implants. For example, a literature review in 2015 by Osman and Swain titled A Critical Review of Dental Implant Materials with an Emphasis on Titanium versus Zirconia stated that, quote, titanium remains the gold standard for the fabrication of oral implants. While studies directly comparing titanium dental implant products from different companies could not be found, one study did find that Galley implants provided a survival rate of 97.4% after a 4-year follow-up, whereas the implant survival rate in immediate loading after 10 years for Straumann's BLX system was reported at 98.2%. While many factors such as biocompatibility, toughness, strength, corrosion, wear, and fracture resistance, just to name a few, ought to be assessed when selecting an implant material, the decision made by a dental professional will vary case by case. Using a survival rate or implant stability quotient may also be a more holistic approach to assessing the use of a particular implant material.
We also used Dr. Eckhart from Conestoga Oral Surgery as anecdotal evidence for the success of Straumann products. He started placing implants in 1985 and placed over 22,000 of them, and he trusted Straumann in his practice.